curious of what. I'm 25 years old, I'm a medical student, and last year I was diagnosed with an osteosarcoma or bone cancer in my right mandible here. It was January of last year when I was working at a school holiday program, and I had what I can only describe as some sort of child flu, like you do when you're in contact with small human beings, and I was dripping all kinds of fluids and my throat was really sore, and all of a sudden I started to notice some numbness just here. I kind of lumped it all together and didn't really think too much of it, but I recovered about a week later. Didn't have any of the fluid things going on, but still had a bit of numbness. The diagnosis process took about 2 months. There was waiting for specialists, being referred, taking scans. A lump had started to develop, and from that lump they were able to obtain a biopsy, and 2 weeks later I went back to get the results. The biopsy had come back with a result saying that I had a really high grade osteosarcoma, that it was quite aggressive, it was growing fast, and that I would be very quickly going into treatment. And that's how I got referred over to the Lifehouse, and that's how I met Prof. Jonathan Clark and his team. I then went through 2 rounds of chemotherapy, and it was planned that I would then do surgery and get another 6 rounds. Every 5 weeks I was in hospital for 3, getting the chemo, getting fluids to try and flush out of my body. It turned my urine all kinds of really wacky fun colours, and during that time there were a few days where I was unwell, but mostly I just became really good at doing the puzzles in the Lifehouse library. I'd been so wrapped up in kind of the life of chemotherapy, losing my hair, and by that I mean having my boyfriend clip it off with his beard razor. And so when it came to my surgical planning, it was almost a shock to the system because I had neglected to think about what was going to come later. So I walked in and Jonathan Clark sat down with me and my mum, and he went through what the surgery would be. It ended up being an 11-hour surgery, and this is what they did in that time. They removed, I think it was 11 centimeters of bone, including all the teeth on the bottom right hand side of my mouth. They also took some of the surrounding soft tissue that the cancer had started to invade into, with the goal of getting the best possible margin without compromising function. After they removed all that tissue, they got some spare parts that I didn't know I had in my body, such as my fibula, and created a free flap. So they removed the entire fibula from my right leg, and they used a special piece of equipment with special parts that they'd ordered specifically for me from Europe based on scans that I'd had before the surgery, and they used it to cut some wedges into the fibula so that they can mold it into what my mandible looked like prior to the surgery, to kind of maintain that symmetry. They also took some skin grafts from my lower leg in a similar area, and used it to kind of duct tape everything together on the inside, which is a really scientific, specific word for what they did. At the same time, they put in 3 dental implants to prepare for the prosthetic teeth that are going to go in really soon, and all of that happened in one day. Afterwards, Prof. Clark left to continue with his clinic, and Kate, his clinical nurse consultant, who I also refer to as my guardian angel, sat with us, and we took some deep breaths together, and she went through the practicalities of what was going to happen. Mum and my family would be notified about halfway through the day how it was going. They would get told once my surgery was done, I would spend about 2 hours in recovery, and then they could meet me in ICU later that night. She also said that I would look horrendous when I came out of surgery, and boy was she right, because I had in total 9 tubes coming out of me. I was like this mechanical octopus, in a really not fun way. So I had nasal prongs delivering some oxygen. I had an NG tube. I had 2 drains coming out of my neck. I had 2 cannulas and an art line. I had a PCA, so I was controlling my, controlling my pain with the button. I had a catheter in, and I had a drain coming out of my leg. Basically kitted out and connected to every piece of machinery possible. I was pale, I was flat. I can't remember any of this, but I know that it was really hard for everybody that came to visit me that night to see. But that being said, I was up and walking the next day. 2 days later, my PCA was taken away, which was a little bit to my despair, not because of the pain, but because you come to know the 3 minutes really well. And that also removed my catheter, the oxygen, some of my drains, and slowly these drains came out. And 10 days after that massive 11-hour surgery, I was allowed to go home. A lot of care went into me, and I think a month later I was back to eating normal foods. The swelling had gone down. I was feeling really well, probably better than before the surgery, when the cancer had, really started to take hold of my little body. I went back to go to chemo again once I'd recovered, and the plot twist was that it wasn't really successful, so they canned the chemo. That was pretty emotionally intense, but very quickly they moved me on to, plan B, and started planning some radiotherapy for me. I remember Justine walking past me when I was early days in my radiotherapy going, "How are you?" And I went, "Oh, I'm great, I'm fantastic, feeling really well, finding this really easy." And she kind of got this look in her eyes like, like she knew what was about to happen, and had this just you wait kind of look, but didn't burst my bubble. Very quickly, however, I started to feel the effects of radiotherapy. So, as you probably know, the problem with head and neck cancer is that there's a lot going on here. Of course, my cancer had to choose a place where there's a lot of other things going on, just to mess with me. And like with the surgery, the recovery can affect all that function. Radiotherapy was the same. There were parts of my healthy tissue that were unavoidably zapped, and I started getting this little ulcer party in my mouth that was not wanted. I had some esophagitis, so I felt a bit nauseous. I started getting burnt on the outside. Started sleeping a lot more. I was getting very tired, and I don't think it was much past week 2 when Justine again walked past me and said, "How you feeling?" And this time it was less of a, this is great, and more of a 5 minutes later she walked back with this show bag full of gifts for me, and not as exciting as the Cadbury show bag from the Easter show, but exactly what I needed at the time, because I started pulling out. There was lidocaine for my ulcers, there was mouth gargle, there was liquid analgesia, there was like ulcer cream, there was burn cream, there was moisturizer, there was the absolute works. I think there was some Ensure and liquid food chucked in there, which admittedly got chucked elsewhere later on because not the nicest thing. But that was really helpful, because what they really stress, and what the dietitian really stressed, despite the fact that I was sleeping 17 hours, had immense pain in my mouth, difficulty swallowing, I had to try and keep my weight up, because you need to keep the same size of your face for your mask to hold you in the same position, and so that they can target the right areas without replanning. You know, getting a peg tube was a very real possibility, but it was something that I really didn't want to have to go through, because I'd already gone through the NG tube and the slow feeding, and it was just, I wanted to kind of maintain some kind of normalcy. And Justine and the dietitian really worked to get me there. So using a combination of my show bag goodies and eating ice cream 3 times a day and having melted cheese on everything and just really long naps. I know I'm making it sound like a holiday, so you can't feel too sorry for me, but I managed to hold my weight up. I didn't need a peg tube and got through the radiotherapy, albeit a little bit sore and sorry, but I finished on the 10th of October last year and managed to ring that bell at the radiotherapy building saying that I finished. It's a year later now, and I've had a few issues with some infections, but other than that, the whole team, the whole head and neck team, all the head and neck nurses, Kate, Justine, everybody else, all of the beautiful people worked really hard to do what they promised me they would try to do at the very beginning, all those months earlier, and that was to help me get through this in a way that I could put it behind me. I'm back at uni now. I eat anything and everything. I had my PET scan earlier this year, which was all clear, and I'm waiting for my next one, which is coming up in the next few weeks, and I really feel like this is something that I am putting behind me, and I wouldn't be able to do that with a smile, literally, and, you know, emotionally, if it weren't for that team. So I guess the last thing that I really want to say is that it takes a really special person to work specifically in head and neck cancer. It's such a complex area with all the different functions that can be affected. I think there's something like 18 different kinds of head and neck cancer, and then beyond that, the individualized care that people need, and to be able to deliver all that really practical care, like the wound care and the exercises and the, you know, everything to do with this area, but alongside with giving patients this sense of dignity when. So thank you from me and from all of the future head and neck cancer patients that you come into contact with, and good luck with everything.